Hi, I'm Charlie, and I started my PhD at the University of Sheffield in February this year. I'm going to talk to you about my project, which aims to understand more about women in the UK who are at most risk of experiencing the severe postnatal mental illness, postpartum psychosis. So why is this important? Evidence suggests that episodes of severe postnatal mental illness have effects not just in the time when a woman might be acutely unwell, but that this illness has potential impacts across her life course. It can also have impacts on the women's children, their families, and society more broadly. So what if there were things that we could do to prevent this, or to reduce and manage these risks? The NHS has put millions of pounds into perinatal mental health care in the last few years, and this map here shows service provision in England. So red is no access and green is pretty good access. So as you can see, this map is turning greener by the year. But even though the map is becoming greener and that there are more services available for women to use, we suspect that there might still be a number of barriers that exist, which mean that women from different backgrounds can't access these services. And this inequity in access, I believe, can contribute to perpetuating health inequalities. So what does the literature say on this? So there's a really rich literature on maternal mental illness, one which I am still in the very early days of exploring, but what I've noticed so far is that it's largely concentrated on postnatal depression. There's a small literature on prevention of severe postnatal mental illness, but it's mostly drug-related studies, and women's voices seem to be absent from them too. In terms of literature on barriers to care, it's largely focused on the postnatal period when women are already ill. But I argue it's important for us to pay attention to women who aren't yet ill, but are at the highest risk of becoming seriously unwell. And I think it's important to scrutinise the care on offer to them. So what do I want to do about this? I want to answer these three questions during the course of my project. And I want to use a mixed methods approach, using a variety of different sources of information. I plan to use routinely collected healthcare data to understand inequalities in access to preconception and antenatal care, to understand who exactly is using these really important parts of the perinatal mental health service. Most importantly, I want to speak to women themselves. Now, we all know that the voices of marginalised women are often absent in health research, so I want to work really hard to understand these women's lived experience and to work with them to really amplify their voices. And my hope for this project is that it will help improve healthcare, which I hope in turn will help to tackle the health inequalities that these women and their families face. Finally, I just want to finish by saying thank you. Thank you for watching the video, and I really welcome any thoughts or suggestions from anyone else who has an interest in this area. Thank you.